what harm reduction means is looking at the individual who is using drugs as a person first and foremost, and addressing their basic needs and not just looking at drug use. In my work, we think about harm reduction as this wraparound service, that can be provided to individuals who are struggling, and make sure that we look at different data, bring different data sets together that really speak to their needs, rather than what we as public health researchers or academics or decision makers in public health think that they need. There's a lot of myths, there's a lot of misinformation and disinformation about harm reduction and what it is. And so I think bringing together, transportation, public transit companies, bringing together criminal justice organizations, bringing together public health, bringing together planners, all in one, treatment providers, all in one space is the strength of the harm reduction perspective. Students are making an amazing impact at Ohio State on addressing the access to treatment and addressing the implementation of the harm reduction perspective on campus. When the Buckeyes for Harm Reduction got started, the conversation on campus around nalox boxes, for example, having nalox boxes in dorms or near dorms, was a non-starter. No one was willing to listen to that conversation. Now, fast forward to today, and those kinds of initiatives are openly spoken about.
So involvement in BHR has completely changed my college experience. In a personal sense, I was able to find a like-minded community of people because it's something that we're all passionate about, and so I've grown really close to people both in and outside of the club, which has been awesome. In a day-to-day sense, it's changed my activities. So before being more heavily involved in a club, I was more focused just on my schoolwork, and now I'm able to have events that I look forward to through BHR, and I'm usually working on scheduling and planning for naloxone trainings. So I have a project that I'm passionate about alongside the rest of my schoolwork.
I really liked the fact that we got more involved outside the classroom, and it was more than just learning about the topic, but actively incorporating it to the community and being able to help other people around us rather than just learn about it. We are involved in a Safe Point syringe program in Franklinton, and then we were able to do some community cleanups around Columbus and do some naloxone trainings and just have good social time with the club.
The legacy of these students is going to live on because even if they have saved one life, I don't know many undergraduate students who can graduate from Ohio State and say the work that we did outside of our academic training, our academic education saved lives. I don't think many people can say that.